I'm Dr. Vivian Ashworth, and I've been an ICU physician at Meridian General Hospital in Asheville, North Carolina for 12 years. Or at least I was, until I requested a transfer to emergency medicine last month. During my career, I've treated over 4,800 critical care patients, witnessed medical miracles that defied all statistical probability, and pulled people back from the edge when their families had already begun planning funerals. But what I'm about to tell you about is the one patient that made me question everything I thought I knew about consciousness, the limits of human capability, and what we truly understand about the mind's connection to the body. This case didn't just haunt me, it fundamentally altered how I view medicine, science, and the very nature of human potential. What started as a routine unconscious patient became a mystery that challenged every principle I learned in medical school and 15 years of practice. The implications of what I witnessed are so profound that I've spent the last 8 months documenting every detail, because I knew that someday I would need to share this story, and that someday is today. Meridian General Hospital is a Level 1 trauma center serving the Blue Ridge Mountains region of North Carolina, Eastern Tennessee, and Southwestern Virginia. As the senior attending physician in our 52-bed intensive care unit, I've handled every conceivable type of critical medical emergency: massive strokes that left patients completely paralyzed, traumatic brain injuries from mountain climbing accidents, multi-organ failure cases where survival seemed mathematically impossible, and cardiac arrests where patients were clinically dead for extended periods before somehow returning to full neurological function. I graduated magna cum laude from Duke University School of Medicine, completed my residency at Johns Hopkins, and specialized in critical care medicine with additional training in neurocritical care. I've been published in the Journal of the American Medical Association, the Annals of Internal Medicine, and Critical Care Medicine. I've presented research at international conferences, trained residents from Harvard and Yale, and been called in as a consultant on cases that stumped teams of specialists across the Southeast. In critical care medicine, you develop what we call clinical intuition, an almost supernatural ability to read subtle signs that predict whether a patient will recover or decline. You learn to recognize the barely perceptible changes in breathing patterns, the microscopic shifts in skin color, the tiny variations in heart rhythm that indicate whether someone will make it through the night. After treating thousands of patients, you develop an internal sense of who will survive and who won't, often hours or even days before the medical data confirms your suspicion. This intuition has saved countless lives. It's allowed me to intervene early when patients were declining in ways that weren't yet obvious on monitors or lab results. It's helped me make split-second decisions about treatments that other physicians might hesitate to attempt. My colleagues often joke that I have a sixth sense about critical patients, and honestly, after 12 years in the ICU, I believed they were right. But the case I'm about to share didn't just challenge my clinical intuition, it obliterated every assumption I had about what the human mind is capable of accomplishing. It was November 15, 2022, a Tuesday evening that started like any other. The autumn air in Asheville was crisp and clear, and I was finishing up my evening rounds, reviewing charts and checking on patients who had been admitted during the day shift. Our ICU was at about 80% capacity, which was typical for that time of year. We had the usual mix of cases: a 67-year-old man recovering from a massive heart attack, a young woman who had suffered a severe asthma attack, an elderly patient with pneumonia, and several others whose conditions were serious but manageable. I was in my office, updating treatment plans and preparing notes for the overnight team, when my pager buzzed at exactly 8:47 p.m. The message was from Dr. Elena Rodriguez, our emergency department chief. Incoming critical transport, unknown neurological condition, ETA 12 minutes, need you in ICU Bay 3 immediately. Patient history is unusual, call me. That last line caught my attention. In 12 years, Elena had never described a patient history as unusual in a page. Concerning, yes. Complex, certainly. But unusual? That was not medical terminology I was accustomed to seeing in emergency communications. I called Elena immediately. What do you mean by unusual? I asked without preamble. Vivian, I've been practicing emergency medicine for 18 years, and I've never seen anything quite like this. The patient is a 38-year-old woman named Celeste Harrington. She was found unconscious in her home art studio this afternoon by her neighbor, who had come to check on her when she didn't show up for their planned lunch. The neighbor said Celeste had been working on a large painting project for the past several weeks. Okay, that doesn't sound particularly unusual so far. What's the concerning part? There was a pause. Celeste has been unconscious for approximately 6 hours, completely unresponsive to all stimuli. But here's the thing. When the paramedics arrived, she was still painting. unconscious but actively working on what appears to be an incredibly complex and detailed artwork. I felt a chill run down my spine. Elena, that's not medically possible. Unconscious patients don't engage in complex motor activities. I know. That's why I'm calling you instead of trying to handle this in the ED. Her vital signs are stable, but her neurological presentation doesn't match anything I've encountered. And Vivian, the painting she was working on while unconscious, according to her neighbor, it's unlike anything Celeste has ever created before. It's apparently far more sophisticated than her usual work. I immediately headed to ICU Bay 3, where my team was already preparing for the incoming patient. My charge nurse, Isabella Chen, had worked with me for 8 years and had seen every type of neurological emergency imaginable. My respiratory therapist, Marcus Williams, was one of the most experienced in our hospital system. My ICU resident, Dr. James Patterson, was in his final year of training and had proven himself capable of handling complex cases. If anyone could make sense of whatever was coming through our doors, it was this team. What equipment do we need set up? Isabella asked as she checked the monitors and IV stations. Full neurological monitoring, I replied, EEG capability, advanced cardiac monitoring, and prepare for possible intubation if her airway becomes compromised. Also, I want continuous video monitoring of this case. Something tells me we're going to want detailed documentation of whatever we're about to see. Dr. Patterson looked puzzled. Is there something specific we should be prepared for? Honestly, James, I'm not sure, but according to the ED, this patient was engaging in complex artistic work while completely unconscious. That should be neurologically impossible, so we need to be ready for anything. The ambulance arrived at 9:03 p.m., 16 minutes after Elena's initial page. What I saw when the paramedics wheeled in our patient immediately confirmed that we were dealing with something far outside the realm of normal medical experience. Celeste Harrington was a 38-year-old woman with shoulder-length auburn hair and what would have been described as an artistic appearance. Paint-stained fingers, wearing clothes that suggested she spent most of her time in an art studio. But what immediately captured my attention wasn't her appearance. It was the fact that her right hand was moving in precise, deliberate motions, despite her complete unconsciousness. How long has she been moving her hand like that? I asked the lead paramedic as we transferred her to our ICU bed. Since we arrived at the scene 4 hours ago. It hasn't stopped. The movements are too organized to be seizure activity, but she's completely unresponsive to verbal commands, physical stimulation, even painful stimuli. I immediately began my neurological assessment. Celeste's eyes were closed, and she showed no response when I called her name loudly. I performed a sternal rub, a painful stimulus that should wake even heavily sedated patients, but there was no reaction whatsoever. Her pupils were equal and reactive to light, which was encouraging, but she displayed no purposeful responses to any external stimuli. Her vital signs were surprisingly stable. Blood pressure 118, over 76, heart rate 72 beats per minute, oxygen saturation 98% on room air, temperature 98.4 degrees Fahrenheit. According to every basic medical parameter, Celeste appeared to be in a state of deep natural sleep, but sleeping people don't continue complex hand movements for hours on end. Isabella, let's get a complete metabolic panel, comprehensive drug screen, thyroid function tests, and a CT scan of her brain, I ordered. I also want an EEG set up immediately. We need to understand what's happening neurologically. While we waited for the test results, I focused on observing Celeste's hand movements. They were unlike anything I had seen in 12 years of critical care medicine. Her right hand moved in fluid, precise patterns across the bedsheet, as if she was painting on an invisible canvas. The movements were too complex and too organized to be random muscle twitches or seizure activity. Dr. Patterson was documenting everything with our video equipment. Dr. Ashworth, look at this pattern, he said, pointing to Celeste's hand. She's been repeating the same sequence of movements for the past 10 minutes, but each repetition is slightly different, like she's refining or perfecting something. Isabella, who had a background in art before becoming a nurse, was studying the movements intently. Those look like brushstrokes, she said quietly. Specific painting techniques. See how she's making small circular motions there? That's how you blend colors. And those longer strokes. That's how you create depth and dimension in a painting. The implications of what Isabella was suggesting were staggering. If Celeste was indeed painting while unconscious, it would represent a level of unconscious motor coordination that shouldn't be neurologically possible. Complex artistic creation requires conscious intention, visual feedback, decision-making processes, and fine motor control, none of which should be available to an unconscious brain. But the evidence was right in front of us.
Marcus, our respiratory therapist, had been monitoring Celeste's breathing patterns. Dr. Ashworth, her respiratory rate is varying in coordination with her hand movements. When her painting motions become more complex, her breathing becomes slightly deeper and more rhythmic, almost like she's concentrating. This was becoming more mysterious by the minute. The initial test results came back within 2 hours, and they only deepened the mystery surrounding Celeste's condition. Her complete metabolic panel was entirely normal, perfect kidney function, liver enzymes within optimal ranges, blood glucose levels stable, electrolyte balance ideal. The comprehensive drug screen was negative for everything: no alcohol, no prescription medications, no recreational drugs, no toxins or poisons that might explain her unconscious state. The CT scan of her brain showed no abnormalities whatsoever, no signs of stroke, no evidence of trauma, no masses or lesions, no swelling or bleeding. According to the imaging, Celeste had a perfectly healthy brain. Dr. Sarah Kim, our staff radiologist, called me personally to discuss the results. "Vivian, I've reviewed the scan 3 times. There is absolutely nothing abnormal about this patient's brain anatomy. Whatever is causing her unconsciousness, it's not structural damage." The EEG results were even more puzzling. Dr. Michael Chen, our neurologist, came to the ICU personally to interpret the brainwave patterns. "Vivian, this is fascinating," he said, staring at the EEG printout. "Celeste's brainwaves show a pattern I've never seen before. They're not consistent with sleep, coma, or any form of unconsciousness I'm familiar with. Look at these patterns." He pointed to specific areas of the EEG tracing. "See these areas? This is alpha wave activity, which typically indicates a relaxed awake state. But over here, we have theta waves, which are associated with deep meditation or creative states. And these unusual patterns here, I honestly don't know what they represent. So is she conscious or unconscious? Based on her behavior and responses to stimuli, she's clearly unconscious, but her brainwave patterns suggest a level of neural activity that's inconsistent with unconsciousness. It's like her brain is in a state that doesn't fit any category we have in neuroscience." While we were puzzling over Celeste's medical condition, Isabella suggested something that would prove crucial to understanding what we were dealing with. "Dr. Ashworth, what if we contacted her neighbor, the one who found her? Maybe if we could see the artwork she was creating while unconscious, it would give us clues about what's happening neurologically." I agreed, and we reached out to Margaret Fitzgerald, the neighbor who had discovered Celeste. Margaret agreed to meet us at Celeste's art studio, which was in a converted garage behind her small house in the River Arts district of Asheville. What we found there was beyond anything I could have imagined. Celeste's art studio contained dozens of paintings in various stages of completion, but they fell into 2 distinct categories. The older paintings, which Margaret confirmed were Celeste's typical work, were pleasant but unremarkable landscapes and still life studies, the kind of artwork you might find at a local art fair. They showed technical competence, but nothing extraordinary. But the painting Celeste had been working on while unconscious was in a completely different category. It was a massive canvas, approximately 6 feet by 4 feet, depicting what could only be described as a visual representation of mathematical concepts. The painting showed complex geometric patterns that seemed to flow and transform across the canvas, with color relationships that created an almost 3-dimensional effect. The technical skill displayed was far beyond anything evident in her other work. "Margaret, how long has Celeste been working on this particular painting?" I asked. "She started it about 3 weeks ago, right after she had that weird dream she kept talking about." "But Dr. Ashworth, this painting, it's nothing like anything Celeste has ever created. She's a good artist, don't get me wrong, but this is at a level that seems almost professional, like museum-quality work." Dr. Patterson, who had accompanied us to the studio, was examining the painting closely. "Look at these mathematical patterns," he said. "I took some advanced mathematics courses in college, and these look like visual representations of calculus concepts, differential equations, maybe even some topology." The implications were staggering. Celeste, according to Margaret, had no background in advanced mathematics. She had been an art therapy major in college and worked as a freelance artist and part-time art instructor at a local community center. Yet while unconscious, she appeared to be creating artwork that incorporated sophisticated mathematical principles. Over the next 48 hours, Celeste remained in exactly the same state, completely unconscious and unresponsive to external stimuli, yet her right hand continued its precise painting-like movements. We had moved her to a private room where we could monitor her continuously, without disturbing other patients. Isabella had suggested something unprecedented. What if we give her actual painting supplies? If she's trying to create something while unconscious, maybe we should let her finish it. The idea seemed medically questionable, but we had exhausted all conventional approaches. Celeste's condition remained stable, and nothing we had tried had produced any change in her neurological status. Dr. Chen, our neurologist, agreed that allowing her to paint might provide valuable information about what was happening in her brain. We set up an easel beside her bed and placed a canvas where her unconscious hand movements could actually create artwork. Isabella gently placed a paintbrush in Celeste's right hand and positioned a palette of colors within reach. What happened next changed everything I thought I knew about the capabilities of the unconscious mind. Celeste began painting, not random marks or meaningless colors, but deliberate, sophisticated artwork. Her unconscious hand selected colors with precision, mixed them in ways that created subtle gradations and depth, and applied them to the canvas with the skill of a trained professional. For 6 hours, while completely unconscious and unresponsive to any external stimulus, Celeste created a masterpiece. The painting that emerged was extraordinary. It depicted what appeared to be a complex visualization of neural networks, intricate branching patterns that resembled both brain neurons and mathematical fractals. The color relationships created a sense of movement and energy, as if the painting itself was alive and thinking. When we showed photographs of the completed painting to Dr. Lisa Wang, the head of the University of North Carolina's neuroscience department, her response was immediate and startling. "Where did this come from?" she asked. "This is an incredibly accurate representation of neural network architecture, the branching patterns, the color coding that seems to represent different types of neural connections. This demonstrates a sophisticated understanding of neuroscience that would typically require years of graduate-level study." I explained Celeste's condition and the circumstances under which the painting had been created. Dr. Wang was silent for a long moment. "Dr. Ashworth, what you're describing should be neurologically impossible. The level of cognitive processing required to create this artwork, the spatial reasoning, the color theory, the scientific accuracy, these are all functions that require conscious awareness and intentional decision-making. But the evidence is right in front of us," I replied. "We have continuous video documentation of the entire process. Celeste was completely unconscious throughout. Then we're looking at something that challenges our fundamental understanding of consciousness and brain function." Word of Celeste's case began to spread through our hospital and the broader medical community. Within 72 hours, we had consultation requests from neurologists, psychiatrists, and researchers from Duke, Wake Forest, and the University of North Carolina. Everyone wanted to understand how someone could produce sophisticated artwork while completely unconscious. Dr. Amanda Foster, a renowned consciousness researcher from Duke University, drove to Asheville specifically to examine Celeste. Her assessment was thorough and disturbing. "I've been studying consciousness and altered states of awareness for 25 years, she told me after spending 4 hours with Celeste. "What you're dealing with here appears to be a case of what we might call unconscious savant syndrome, but that's not a real medical diagnosis because this condition shouldn't exist." "What do you mean?" "Savant syndrome typically occurs in individuals with autism or other developmental conditions where one area of the brain shows extraordinary ability while others may be impaired. But savant abilities always require some level of conscious awareness. What Celeste is demonstrating, complex artistic creation during complete unconsciousness, has never been documented in medical literature." Dr. Foster reviewed all of our test results and monitoring data. "Her brainwave patterns are unlike anything I've seen. It's as if her mind has accessed some level of cognitive ability that normally remains hidden or unused in conscious individuals. Is there any precedent for this? There are scattered reports throughout medical history of people demonstrating unusual abilities during altered states of consciousness, speaking foreign languages they've never learned, performing complex mathematical calculations, creating sophisticated artwork. But these cases are usually dismissed as anecdotal or poorly documented. What you have here is the most thoroughly documented case I've encountered." The implications of what Dr. Foster was suggesting were profound. If Celeste's unconscious mind could access artistic and intellectual capabilities beyond her normal conscious abilities, what did that say about the unused potential of the human brain? On the morning of day 5, something changed. I was reviewing Celeste's overnight monitoring data when Isabella called me urgently to her bedside. "Dr. Ashworth, her hand movements are different this morning. Look." Instead of the painting motions we had observed for 5 days, Celeste's hand was making what appeared to be writing movements. Her fingers moved as if she was holding a pen and forming letters and words on an invisible page. We immediately provided her with paper and a pen. What happened next was as mysterious as everything else about her case. While still completely unconscious, Celeste began writing, Not random marks or illegible scrawls, but clear, precise handwriting. For 2 hours, she filled page after page with what appeared to be detailed descriptions of artistic techniques, color theory, and principles of visual composition. The writing was far more sophisticated than anything that should have been possible from someone with Celeste's educational background. She wrote about advanced concepts in art history, detailed explanations of painting techniques used by master artists, and even philosophical discussions about the nature of creativity and artistic expression. When we showed the writing to Dr. Jennifer Mills, the head of the art history department at the University of North Carolina at Asheville, her response was immediate. This demonstrates a graduate-level understanding of art theory and history. Where did your patient study? According to her records, she has a bachelor's degree in art therapy from a small college in Tennessee. No advanced training in art history or theory. That's impossible. This writing references obscure art historical texts, discusses techniques that are only known to serious scholars, and demonstrates insights that would typically require years of intensive study. But the most extraordinary moment came at 10:47 a.m. on day 6. Celeste opened her eyes. The transition from unconsciousness to full awareness was unlike anything I had witnessed in 12 years of critical care medicine. One moment Celeste was in her familiar state of unconscious artistic activity, and the next moment she was sitting up in bed, looking around the ICU with clear, alert eyes. "Where am I?" she asked, her voice clear and strong despite having been unconscious for 6 days. "You're in the intensive care unit at Meridian General Hospital," I replied, moving closer to her bedside. "I'm Dr. Ashworth. How are you feeling?" Celeste looked around the room, taking in the monitors, the IV lines, and the paintings and writing materials that surrounded her bed. "I feel different, really different, like I've been somewhere else for a long time." I performed an immediate neurological assessment. Her reflexes were normal, her memory of events before her collapse was intact, her speech was clear and coherent, and her reasoning appeared sound. There was absolutely no indication that she had been unconscious for nearly a week. "Celeste, do you remember what happened to you? Do you remember the past 6 days?" She was quiet for a moment, her brow furrowed in concentration. "I remember being in my studio, working on a painting. But it wasn't like normal painting. It was like the painting was painting itself through me. I could see things, understand things about art and color and form that I had never known before." She noticed the canvas beside her bed, the neural network painting she had created while unconscious. "Did I paint that?" "Yes, you created that while you were unconscious." Celeste stared at the painting with an expression of wonder and confusion. "That's not possible. I could never paint something like that. The technical skill, the understanding of neuroscience. I don't know anything about brain anatomy." But as she continued to look at the painting, something changed in her expression. "Actually, I do know about it. I can see how the neural pathways connect, how the synapses transmit information, how the different brain regions communicate with each other. But I don't understand how I know these things." Over the next 24 hours, as Celeste remained awake and alert, we made a discovery that was perhaps even more extraordinary than her unconscious artistic abilities. She had retained everything. The sophisticated understanding of art theory that she had demonstrated in her unconscious writing was still present. When Isabella showed her art books and asked her to explain various concepts, Celeste provided detailed, accurate explanations that demonstrated graduate-level knowledge. "I don't understand it," Celeste told me during one of our conversations. "It's like there are 2 sets of memories in my mind. My normal memories of growing up, going to college, learning basic art techniques, and then these other memories of studying with master artists, reading advanced texts, understanding principles that I've never actually learned." We brought in Dr. Mills from the university to test Celeste's newfound knowledge. The results were remarkable. She's demonstrating expertise equivalent to someone with a PhD in art history, Dr. Mills told me privately. She can discuss obscure Renaissance techniques, analyze the compositional principles of abstract expressionism, and explain color theory at a level that I only see in my most advanced graduate students. But the retained abilities weren't limited to art and art history. When we showed Celeste the pages of writing she had produced while unconscious, she could read and understand all of it, and even expand on the concepts. "It's like I accessed some part of my mind that was always there but hidden," she explained. "I can feel this knowledge now, but I can't explain where it came from." Dr. Foster, the consciousness researcher, was fascinated by Celeste's retention of unconscious learning. This suggests that the human brain has far greater capacity for acquiring and storing information than we typically access in normal consciousness. Celeste somehow tapped into that potential during her unconscious period. Celeste's recovery was rapid and complete. Within 48 hours of awakening, all her vital signs had normalized, her neurological function was perfect, and she was ready for discharge. But the questions raised by her case were profound and disturbing. If Celeste could access extraordinary artistic and intellectual abilities during unconsciousness, what did that suggest about the unused potential of every human brain? How much knowledge and capability do we normally keep locked away in unconscious regions of our minds? Dr. Chen, our neurologist, was particularly troubled by the implications. Vivian, if unconscious states can provide access to enhanced cognitive abilities, it challenges our entire understanding of how the brain processes and stores information. We might be looking at evidence that consciousness actually limits our access to our own mental capabilities. The hospital's ethics committee convened to discuss the case. There were questions about whether we should have intervened to wake Celeste sooner, whether her unconscious artistic production constituted informed consent for the creation of valuable artwork, and what our obligations were regarding the documentation and study of such an unprecedented case. But I was more concerned about the practical implications. If Celeste could spontaneously develop these abilities, might other patients be experiencing similar phenomena that we were missing or dismissing? How many people had we treated for unexplained unconsciousness without recognizing that their minds might be engaged in extraordinary activities? I started reviewing cases from the past several years, looking for patients who had shown unusual behaviors during unconscious or semi-conscious states. What I found disturbed me. My investigation revealed 3 other cases from the past 18 months that showed similarities to Celeste's condition, though none had been as thoroughly documented or studied. Case 1. Robert Kim, a 45-year-old accountant who had been unconscious for 3 days following a minor car accident. During his unconsciousness, he had made repetitive finger movements that nurses had dismissed as random muscle activity. But when I reviewed the video footage, the movements appeared to be consistent with complex mathematical calculations. Robert had awakened with no memory of the unconscious period, but had subsequently shown an unprecedented ability to perform complex financial analyses that were far beyond his previous capabilities. Case 2. Maria Santos, a 29-year-old teacher who had been unconscious for 2 days during a severe case of pneumonia. While unconscious, she had made vocal sounds that were initially thought to be random vocalizations, but when I listened to the audio recordings, they appeared to follow patterns consistent with multiple foreign languages. After awakening, Maria discovered she could understand and speak conversational French, German, and Italian languages she had never studied. Case 3. David Chen, a 52-year-old construction worker who had been unconscious for 5 days following a workplace accident. During his unconsciousness, he had made hand movements that appeared to be random gestures, but when I reviewed them carefully, they looked like someone conducting an orchestra. After awakening, David, who had never shown any musical ability, could play piano at an intermediate level and demonstrated an intuitive understanding of musical composition. None of these cases had been investigated as thoroughly as Celeste's, and the unusual abilities had been dismissed as coincidences or explained away as previously hidden talents. But when viewed as a pattern, they suggested something far more significant. Were these isolated medical anomalies, or were we witnessing evidence of a phenomenon that challenged our understanding of human consciousness and capability? As I compiled my research on these cases, I realized that what we had discovered with Celeste was not an isolated incident, but potentially the tip of an iceberg. There appeared to be a pattern of patients accessing extraordinary abilities during unconscious states, abilities that persisted after awakening. But Celeste's case was just the beginning of a journey that would completely transform my understanding of medicine, consciousness, and human potential, because what I discovered next made Celeste's artistic abilities seem almost ordinary by comparison. The other cases I investigated revealed phenomena that would force me to question not just how the brain works, but what it means to be human. The mind that awakened from unconsciousness was not the same mind that had fallen asleep, and that realization would haunt me for months to come. 3 months after Celeste's discharge, our ICU began seeing cases that defied every medical principle I knew. It started with Nora Blackwood, a 44-year-old librarian from nearby Black Mountain who arrived after collapsing during a book club meeting. Like Celeste, Nora fell into an unexplained unconscious state. Her vital signs were stable, brain scans normal, but she remained completely unresponsive. What made her case extraordinary was what happened on day 2 of her unconsciousness. Nora began speaking. Not random vocalizations, but fluent medical diagnoses of everyone who entered her room. While completely unconscious, she accurately identified that Isabella had early-stage diabetes, that Dr. Patterson had a minor heart murmur, and that Marcus was developing kidney stones, all conditions that were later confirmed through testing, but had shown no obvious symptoms. She's reading our medical conditions like she has X-ray vision. Isabella whispered to me after Nora had correctly diagnosed her pregnancy before Isabella even knew she was expecting. When Nora wakened after 5 days, she retained this diagnostic ability. She could look at people and immediately sense their health issues with uncanny accuracy. I can see it somehow, she told me, like there are colors around people that tell me what's wrong with their bodies. 2 weeks later, we admitted Elena Morrison, a 31-year-old restaurant server who had never progressed past high school algebra. During her 4-day unconscious period following a severe allergic reaction, she filled dozens of pages with complex mathematical equations, work that Dr. Richard Hayes from the University of North Carolina's mathematics department called breakthrough-level theoretical mathematics. These equations solve problems we've been working on for years, Dr. Hayes told me in amazement. She's derived new mathematical proofs that could revolutionize several fields of study. Elena awakened with complete understanding of advanced mathematics, theoretical physics, and quantum mechanics. It's like the universe suddenly made sense, she said. I can see the mathematical patterns underlying everything, the geometry in flower petals, the calculus in bird flight, the physics in water flowing. Within 6 months, I had documented 12 cases of what I began calling unconscious enhancement syndrome. Each patient fell into an unexplained unconscious state, demonstrated extraordinary abilities while unconscious, and retained enhanced capabilities after awakening. The abilities ranged from artistic mastery and mathematical genius to medical intuition, linguistic fluency, and even what appeared to be enhanced empathy and emotional intelligence. But the most disturbing pattern was how these patients described their experiences. It felt like I was connected to something larger, Celeste had said. Like I could access all human knowledge, Elena added. As if consciousness normally limits what we can perceive and understand, Nora concluded. My documentation of these cases attracted attention from researchers worldwide, but it also brought skepticism from my colleagues and concern from hospital administration. When I presented my findings at a medical conference, the response was swift and harsh. Dr. Ashworth's conclusions are unscientific and potentially harmful to the medical profession, wrote one reviewer. My research funding was cut. Colleagues began avoiding me. The hospital administration suggested I was too emotionally invested in unusual cases. When I insisted on continuing my investigation, they questioned my fitness for ICU work. The breaking point came when I refused to discharge Thomas Wright, a 39-year-old carpenter who had been unconscious for 2 days and was showing signs of developing enhanced spatial reasoning abilities. Hospital administration ordered me to stop prolonging unnecessary treatments for neurologically normal patients. That night, I submitted my resignation from the ICU. I now work in emergency medicine at a smaller hospital, where I continue documenting cases of unconscious enhancement whenever they appear. The 12 patients I studied have all maintained their extraordinary abilities. Celeste has become a renowned artist, whose work is displayed in major galleries. Elena is pursuing a PhD in theoretical physics. Nora works as a medical intuitive, helping doctors identify difficult diagnoses. Each has asked me the same question: why did this happen to us? I believe we witnessed evidence that human consciousness normally operates far below its potential capacity. During unconscious states, these patients somehow accessed capabilities that remain hidden during normal awareness. The implications terrify me. If unconsciousness can unlock superhuman abilities, what does that say about the limitations of normal human consciousness? How much of our potential do we never access because we remain awake? Sometimes I wonder if consciousness itself is the barrier that prevents us from becoming something more than human. The mind that awakened was not the same mind that fell asleep, and that truth will haunt me forever.